Welcome, everybody. We're so pleased that you can join us today for the seminar. I'm just personally really thrilled to introduce my friend and colleague, Dr. Lumpkins, today. Um, Dr. Lumpkins is an associate professor in the Department of Communication at the University of Utah and cancer communication researcher within the Population Sciences Division of the Huntsman Cancer Institute in Salt Lake City. Her current and primary research interests are in evidence-based public health communication, cancer-related genetic counselling, testing and risk communication, and implementation science targeted to racial and ethnic minority populations. And I had the great pleasure of getting to work with Dr. Lumpkins during a genetic counselling fellowship, and particularly around promoting community-based participatory research methods with trainees, and it's been an absolute pleasure. So I'm really thrilled. Welcome, Crystal. It's so nice to have you here today, and I can't wait to hear your talk. Thanks all.
Thank you so much, Rebecca. I really appreciate that. Such a kind introduction. And I so appreciate, as you mentioned, working with you. And I appreciate the invitation to speak about my research, which does focus on health communication and engaging with underrepresented populations. And so this title today, really advancing health equity through community engaged health communication scholarship, research that speaks the language, really speaks a lot to who I am as a communication scientist and the work that I do. I will say that I have no disclosures. So today in the talk, I will just reorient us. I know we know so much about cancer disparities that we see across the nation, but we'll talk about that in the context of Black Americans. And then I will speak to the centrality of health and science communication and how this scholarship, the engagement in this area of health and science communication are very important to address health inequity. And then I will end with, again, just reemphasizing community engaged health communication and how that type of communication or scholarship is important to address health inequities. I wanted to, this is a little bit, I wouldn't say unconventional, but I wanted to start off with looking at narratives. As a health communication scholar, a person that has a background in journalism, was a reporter, I thought it would be just really nice to look at some of those narratives that are out there in society. And these are these bullet points. The first is something, unfortunately, that has been perpetuated for several years. Blacks have a higher tolerance of pain. And the second bullet point, people don't get the coronavirus, which we know these are myths. So for this first bullet point, Blacks have a higher tolerance of pain. This was something I pulled from JAMA from 2022. And unfortunately, because of this perpetuated myth, there's been just bias in treatment among Black patients. And unfortunately, this implicit bias among physicians has been false beliefs that have really spelled or has contributed to disparities in treatment with pain. The second bullet point, people don't get the coronavirus. This is something that I pulled from the Chicago Sun-Times. And this was actually a narrative that was in my own faith community during the height of the pandemic. There were the myths that Blacks, because they don't get coronavirus, it's the more the melanin in the skin, or that, and even young people among this population are not susceptible to coronavirus. So very dangerous narratives that were floating around during that time. These two bullet points are cancer-specific narratives, not false or myths that were perpetuated, but unfortunately, these are narratives that have contributed to disparities. This first bullet point, you're too young to get screened for cancer. This was pulled from a online magazine, Self. The second bullet point is actually from some research within the communities in Kansas, the state of Kansas, where I worked with Hispanic and Black communities. And this bullet point says, I'm 43 and I've never been offered a genetic test. And it's, I have sitting here, and so I'll go through and read it verbatim, but essentially this is a quote from a focus group that was held, that this individual is saying, I've been going to the same person for several years and have never heard about this genetic test. So these are deficits in communication, clinical patient communication. And this, I just wanted to show, do a deeper dive into just showing a little bit about this individual's, Allison's journey, and why the deficits of communication. She actually started a nonprofit or advocacy online. Here's just a little bit about her story, where unfortunately this was again during the mentioned the coronavirus and myths. This was during the height of the pandemic, May 2020, and she was 35 at this time. So she was experiencing symptoms. She went to her physician, presented with symptoms, and wanted to advocate for herself. But the doctor sort of just said, well, that's something like, maybe that's a muscle ache. She mentioned that she had been carrying her daughter at the time that was 2 years old. And the doctor said, oh, you may have pulled a muscle. And so a mammogram wasn't ordered. And we do know that there's scientific evidence based on the guidelines for mammograms that are 40 and older. And according to this story, she did not have a risk for breast cancer. But what's unfortunate in this situation is that her symptoms progressed. And so she advocated for herself, but in her journey, she was also imagining, what if there were others that didn't have the wherewithal or the just the follow-up steps to go back to the doctor to be an advocate for themselves. So unfortunately, she had breast cancer, stage 3. And if it had not been for her advocating for herself, this could have been a very different outcome. So that was her voice. She decided to use her voice to address advocating for yourself. Another narrative which speaks to the second bullet point about the participant in the study that did not know about genetic testing and had been going to a clinician or a clinical place for years, Laura Crandon. I was fortunate to meet this individual at the National Society, or through colleagues or scholars within the National Society of Genetic Counseling. And this individual, was very fortunate to meet with her and talk to her about her journey. And because of the lack of knowledge, awareness, and knowledge, and going through her journey as a breast cancer patient and now survivor, started Touch for Life. Her information is now on a website, a platform that Black and Brown individuals are going to get information. And the other very huge opportunity for her was to use her story and also her experiences around genetic testing and the deficit of information. And so that's where the Black Genes Matter movement has started. And she's been such an advocate for that. So this brings us to this landscape of communication, and then also unfortunately, gaps in communication. So as a communication scientist, there are several opportunities to intervene on multiple levels. And going back and speaking to or looking at the myths, such as the pain, uh, the tolerance myth and coronavirus myth. And so, and then also the deficit of information. And so here we have, on the mass societal level, unfortunately, going back to the example with coronavirus, where there was the infodemic, where that's the mixture of both credible, accurate information and also myths. And so you have all these things occurring on a mass societal level, um, that makes it very difficult and complex for individuals to even make a decision. Um, and then so forth, community networks where there are opportunities, going back to the Laura Crandon example, where she is using her website, she's using social media, and the other individual to get information out there, to address deficits. Organizational, I'll talk more about this. This is where, in my experience, working with trusted organizations such as churches and faith-based organizations, community-based organizations are very critical, uh, because of their trust, because of the affinity groups that are within those organizations. There is the opportunity for this two-way communication where they're getting information firsthand, and it's not something that is far removed. But what I will say that as we're looking at this, all of these levels are synergistic, and an individual at any point of time can or is getting information from peers, trusted peers from within their affinity organizations, such as churches, and within networks, because they are on the social media. If they, no matter if they're younger or older, my sons tend to say, "Hey, mom, you're using Facebook, we're using Snapchat and others," but we're all, in this day and age, we're using something like that. And then mass societal. So this comes to, again, the focus or central part of the focus of this talk today about community engaged health communication. And so this is not saying this is a solution for everything, but it is a solution because of just unfortunately the cancer disparities that we're seeing that are persisting. And so when we look at the landscape of cancer, um, I know that you're familiar with this. There are unfortunately millions of people that are still being diagnosed with cancer, that are dying from cancer. Cancer is the second leading cause of death among people that are under 65. And it is the second leading cause of death. Unfortunately, with African Americans, Black Americans, I feel many times that I'm repeating myself. I've been in the academy for over 15 years, and it seems that we are making strides, and we're seeing rates or incidents go down, and screening that has been increased, but still, unfortunately, this group is still shouldering a large proportion of the burden of cancer. And in Utah, so Utah, there is a 2% African Americans or Black Americans, I should say, but are still shouldering a disproportionate number of cancer mortality. This is a picture of Utah, of new cancer cases in Utah. And on the left, there is the colors of where the darker areas is where the more of the cancer incidence is, the new cancer cases are occurring. And it's in the northern part, a lot of it is in the northern part of Utah, which are rural areas, but then also a concentration of African American and Black immigrants. And so this leads me to this tool that I've used, this neighborhood atlas. So the preceding slide shows the cancer incidents or those new cancer cases this tool has allowed me in my research to also look at specific areas, geographic areas, neighborhoods. And this Atlas tool is something that, excuse me, that has been just very informative about neighborhood disadvantage. And if you see, this is just like a kind of a broad scope or picture of the United States. But I wanted to make sure to show specifically Utah, and where you see there are North Ogden, which is an area that has a large percentage of, or the percentage of African Americans, Layton as well. And then if you go to the urban core of Salt Lake City, or West Valley City, which is those, a lot of those red areas, speaks to the disadvantaged areas that we're looking at income, we're looking at resources, a lack of resources. And so what that means to me as a health communication scholar also is that, okay, this is an area in which there is unfortunately disadvantage, and then also going back to cancer disparities that are occurring in these areas. So with the centrality of health communication, I think it's always important to go back and look at defining and looking at what it is, health communication. And so these are some definitions that I've pulled from a well-known scholar, also author of a public health communication book that I teach out of, which speaks to the interdisciplinary capacity, or nature, I should say, of public health communication, and that the focus is to improve health communication through an interdisciplinary capacity. So it's not only scholarship, but it's also the practice, the strategy of how to find the best approaches to address health behavior outcome. And then the National Institutes of Health, I really appreciate the emphasis on scientific development, strategic dissemination that is relevant, accurate, and accessible for and understandable for the intended audiences to advance public health. And then finally, which this definition from the International Encyclopedia of Public Health, one that really spoke to me when I was putting this talk together, because it's very specific with talking about exchange of health information via language. And it's not, as we know, it's not just communicating verbally like I'm doing now, but there are nonverbal cues, it's symbolism, linguistic codes that cannot be underestimated, or I should say, not underestimated, but not emphasized. When we talk about different communities, as I work here with Black immigrants and African Americans, even within those groups, there are different nonverbal cues. There's different cultural symbolism when we talk about different barriers and fears. So just something to consider as we're talking about centrality of health communication. And then further, this just more of the same with the Society for Health Communication, where here it is the science, where we talk about the not only the scientific method, but the rigor and the methodological process of how communication, what it is, and then the art, the approaches of using health communication to advance health and well-being of populations. I wanted to also look at this. So we talk about the centrality of health communication, but then also as we're talking about community engaged health communication, it's important to also look at community engagement and community engaged research and how that is such a central part of health communication, when you are addressing or using health communication to address cancer disparities or health disparities and advancing health equity. And so this is a continuum of community engaged research. And the reason why I wanted to show this is because at any given time, and drawing from my own experiences, that community engaged research is it's occurring over this continuum, such as this first describes community place where the researcher is in charge. And this part of the continuum could make sense when you're presenting, like in my research. I'll show that I'm presenting what it is I'm doing as a community engaged researcher, such as my research in Kansas City, and then now I have been here in the Mountain West area, and engaging with those communities from that part of the continuum. And then hopefully the process of health communication or community engaged health communication would evolve. Community-based research where the researcher is still in charge, but this is something where the community is even more involved with informing me or the researcher of optimal ways of engaging with the community for optimal health communication. And then progressing to community-based participatory research, which many of us refer to as the gold standard, because the researcher and the community members are equal partners and are actively contributing to the research design. First of all, before the research design, what is the health communication problem or the issue? And then finally, the community is driving the research. And so I'll make sure to reference this as I'm talking about the research that I'm doing. This is an example. I thought it would be beneficial to see a glance, just at a glance, from my experience as a communication scientist, and how my lens as a communication scientist, a former journalist, a former public relations person, is all informing community engaged health communication. And so am I bringing this up to say, hey, here's another feather in my cap? Not so, but just to show that the intersection between journalism and just health communication and scholarship and practice and community or public health communication, genetics, a very specific type of communication leads to, again, this intersection where it is contributing to optimal health communication that can be very beneficial to advance health equity. So here is, again, just some of my process as I started off as a journalist, was a broadcast news journalist, and was able to see from a very different perspective as being, quote, the watchdog of society, but then also now as an academic health communication scholar, seeing how the media is it can be very powerful, very persuasive, and using or seeing opportunities to use the media, for instance, as a vehicle for science communication, but for disseminating information. And then engaging with important stakeholders, as you see my experiences of people that have expertise, whether they are primary care providers or patients or cancer survivors, using those voices and engaging with them in a way that's very important to infuse those voices, that information into health communication that can address fears, barriers, and so forth. This is a lot of information here, but I wanted to capture some things from this National Academies of Sciences, engineering medicine. There's a chapter that's from this committee, excuse me, on the science of science communication. And this chapter essentially captures not only the complexities of communicating science, but the importance of engagement. And so here, again, I'm not going to read this verbatim, and these slides will be available. But in this chapter, they're talking about just in this day and age where there's a lot of complex, when you think about scientific breakthroughs, or you think about just new clinical trials, or there are suggestions as far as use aspirin, don't use aspirin, use, or giving the audience or the mass society, individuals in society, there are reports of latest breakthroughs. It's complex. And because there are so many things that are shared within the community, there should be, as this chapter was underscoring, there needs to be a goal of helping to demystify, to explain, and to share important in science communication or scientific breakthroughs in a very understandable way. And so here, they also underscore that this sharing information to make a decision is important, but then also engaging, public engagement as a communication strategy is something that is important. And I really like this last part here because it embodies a lot of the work I do with genetic counseling and testing risk communication. It says engagement models increasingly are used in risk communication as an important way to address questions and conflicts related to the ethical, legal, and social issues that arise around science. So not only health communication, but science communication, important, and then engagement around those are critical. Here, another article that I thought was really important as this conversation or this talk that I'm having about behavioral, social, and communication sciences are important to come together. So I really appreciate talking to Dr. Zhang. I hope I'm saying your name right. So forgive me. Yesterday, when we were just talking about transdisciplinary research, and here this just embodies the importance of transdisciplinary research, and specifically how communication science contributes to cancer prevention and control, and addressing inequities. The social determinants of health. This is something that is a very important piece of when I'm, just talking about community engaged health communication, and it also ties into the work that I do. And so when we look at social determinants of health, this is pulled from the Office of Disease Prevention and Health Promotion. And I'm sure you're familiar with this, the 5 domains, and how there is the emphasis or the for the Healthy People 2030 goals. And so in the social and community context, I won't go out to the website, but in that social and community context, there are the health literacy and other health communication specific factors are outlined under this social and community context. And so seeing that also speaks to uh, very strategically identifying some of those determinants. And in my work, the determinant is looking at communication as a determinant, and specifically um, the infrastructure. So I'll get to that in just a moment. And so here I pulled just a picture from the Brookings Institute, and then also Modern Healthcare, where they are saying in these articles why we should consider patient communication should be considered as a social determinant of health, and then how poor communication exacerbates health inequities. And so looking at communication and how communication is exchanged very specifically among specific populations is, in my view, in my work, as important to understanding how to intervene. And so this is an article that from Goldburn and Yanovitsky that look that you can see that there's the information environment, communication infrastructure, and that's what I'm referring to about looking at the communications infrastructure as a social determinant of health. And then you have the communication and behavioral outcomes. And so what the argument here is that the model is highlighting essentially ways in which knowledge and information gaps are causing unequal distribution for individuals such as African Americans, Black immigrants, to access information, to process this information. And so these scholars are essentially looking at this communication infrastructure as a bridge to the outer context of information environment, where you can see this is where there is the health information that in that outer context, and then this communication behavioral outcomes, that's the individual, how they're able to, going back to health literacy, how they're able to understand information, and this communication infrastructure being a very important place where scholars such as myself can engage with essentially storytellers within the community to help mitigate communication deficits. And so coupled with CIT, which is communication infrastructure theory, is essentially that where, and this is an example here, you see residents, geoethic media, such as here, there's Impact Magazine in Kansas City, where I was for several years. There's the Kansas City Call, Kansas City Globe, then community organizations such as faith-based organizations. And then going back to my example where I was looking at neighborhood storytelling networks. And this is all communication within a communication infrastructure of an action context, where you have an exchange of information between creators of content and also consumers of content. And that's, again, a way that communication between these creators of content and consumers, trusted individuals, trusted organizations, can be very optimal. Here is an example of the next step, if you will, where looking at that storytelling network and that opportunity of that exchange between consumers and creators is a public health approach, a tool, is communication asset mapping. And so this is a tool that I have been working with the communities in Kansas City, Kansas, and Kansas City, Missouri, and now here with looking at how this can be an important communication tool that can be a tool that optimizes information about, for instance, genetic counseling and testing risk communication. And so the communication asset mapping borrows from community asset mapping, a public health approach, and specifically this ABCD, asset-based community development approach, where you're looking at operating in a neighborhood, which you can think about neighborhood associations, and where you see around your area, there are deficits, or there's the assets. What are my assets around me? For instance, here in Utah, a very specific, going back to Ogden and Layton. In Ogden, there are Weber State University, which has several programming that is geared and focused to Black immigrants, African Americans. There is the center named after the first African American mayor in that city, post offices, libraries, those types of things, where those are assets that can lead to optimal health, but then also optimal communication. There are places that people trust, they go to, they frequent, churches. Second Baptist Church in Ogden is one of the largest out of 7 Black churches here in the greater Salt Lake City area. And so looking at mapping as a way to see where not only spaces and places where people trust the people within those places, but also the information. And so here on this side, you see this is pulled from a study. This was in California, where these are places and spaces that were trusted and where information, newsletters, posters were posted. And so, and this is just more information where you can see the map and the legends and how the information corresponding on the left, I'm not sure if it's kind of small, but for instance, the post office, this is where several residents would get their information. And then it says opportunity for bulletin board to share brochures, posters, and flyers and so forth. And one of the major pieces I'll say too with this communication asset mapping is that you have trusted individuals such as promotoras, which are in the Spanish-speaking populations. Those are individuals that have are from within the community, first of all, and they have a working knowledge of specific health information, health education. And so these individuals are the links that are linking again to those creators and those consumers in that communication action context, in that storytelling network, that are liaisons for information. And in my research, I should say our research with the community, we're looking at CHEs, community health educators, which are lay health advisors within those churches, such as Second Baptist back in Kansas, the network of churches in Kansas that were very instrumental in being from within the community, but then also connected with me as a researcher and other stakeholders, such as the genetic counselors. So this brings me to this intersection of community engaged science and health communication. And so again, just this overlap of community engagement, science communication, again, the science of how to effectively disseminate very difficult or maybe complex information that's important, but in terms that the intended audiences will understand, and then health communication and practice scholarship, where that's important, and that being a part of community engaged science and health communication. And as I will say, many times myself as a researcher, I'm thinking of the community that's important, yes, but also other stakeholders in the academy. And so we have individuals, not sure all who's on the call, but we have biomedical, basic scientists, other type of scientists that that expertise coming together with a variety of stakeholders internally, inside the academy, outside of the academy, very important. Again, going back to transdisciplinary, to come together to address these issues. Here finally is just some examples of the research that I've done in the greater Kansas City area, which I've been very fortunate to, since 2012, to be able to work with community members in the faith community, but then also with different people within the academy. As I mentioned, basic scientists, clinical researchers, all coming together to address, at the beginning it was colorectal cancer from multiple levels. And then because of community engagement and being open to seeing what other ways that we could address cancer disparities, a genetic counselor approached me. This was back in 2016, 2017, about a phenomenon that he was experiencing in his clinical practice, where African-American men particularly were had appointments with him, but they wouldn't show up. And so it was because of that conversation and engaging with him, and then introducing him to the network, the community advisory or consortium and community advisory board that I've been working with, that we, through those conversations, we said, this is something that we've never heard of. We've never heard of this opportunity for another prevention tool. And so that was the genesis of working with that individual, and then opportunities to raise awareness about genetic susceptibility testing. And that work also led to just how to, during COVID-19, to be responsive. Had it not been for the community engagement with around colorectal cancer, genetic susceptibility testing, when COVID-19 hit, we were able to pivot. So that was really that conversations and working together in a community engaged capacity helped us not only to have a recently published chapter for emergency preparedness in faith communities, but then also we were able to contribute to how churches were able to use technology, smaller churches. And so a lot of that information has then, and knowledge has come with me to the greater Salt Lake City area. And we have begun exploratory research in the genetic susceptibility testing, risk communication area. This is the current pilot project that I'm working with the Delta Sigma Theta sorority, incorporated the greater Salt Lake City area, which is pilot. And those aims were to build capacity or build collaboration to address cancer disparities among Black women. And then also to explore these attitudes, perceptions, and beliefs toward genetic counseling and testing in this area. And I cannot tell you how appreciative these individuals are. They're already working. They've been working here for 35 years. But one of the comments from one of the officers said, we're here, we've been here, but we feel like we're invisible. And so with this project, they're very happy and excited to partner. And so we've done a lot just with the community or building capacity. There's a community action team is what we call the team, and have done several engagement with other organizations, Divine Nine, which is also known as the Black Greek letter organizations that are here. And while that was going on, it was really important to also talk about sustainability too, because that has been an issue in some cases, not only here, but also in my previous work with, okay, so what else? What else is beyond that? So that's been important to talk about those things. So again, this is a pilot, and I hope I'm not running too much on time, almost done. That this is ongoing, and so this is one of the quotes that I pulled from just last month in a focus group that we conducted in one of the churches. And this individual says, you know, as a Black woman, um, this is what we need. And she goes on to say, don't make it difficult. So in her experience and other people within these conversations, I found that the cancer experiences was huge. So in some cases, it was, we got to the question about what are your perceptions, you know, about just genetics and genetic testing. In some cases, just the entire hour was just about their experiences with cancer and being seen and being heard. And here is another quote that was from another church. This was back in September. And this individual was talking about their cancer treatment and that they were very angry that, you know, there's no cancer in their family. But essentially she said, you know, um, uh, and this is, again, I was a moderator, so I just remember some of the comments before this that until they got to the conversation, it was sort of like a revelation to them. Wow, if I had a conversation with other people, and now that I'm connecting this to Angelina Jolie, hey, this is something that really makes sense, and maybe I should have done it. And so the conversations have actually not only turned into a scientific, for us, information that's important to build health promotion programming, but it's also has been an opportunity for them to communicate among themselves and have a group of peers that they feel comfortable with talking with, and could actually lead to informed decision-making about genetic counseling and testing. So concurrently, a project that I have is one that is specifically engaging with Black immigrants. And so that's began January 2023. It has taken a while for this project because of I will say, again, some of the barriers, cultural barriers, understanding, okay, what are you doing with the research, building trust. And so we've really been able to partner with Best of Africa, talk with her, and now see the sites for working on research that we can talk with informally and formally community health workers within that organization, and then also within that community. So finally, ongoing work and the next steps, continue collaboration with these different populations, not only in Utah, Kansas, also Minnesota. I have an opportunity to partner with Dr. Heather Zierhut there, and wanting to connect and with many of you, hopefully, in the future. And then focusing on the development, going back to the communication asset mapping, where I'm gathering pilot information on that, continue pilot information, and then just continuing to work on that project. and continued engagement here with the community advisory boards, are the CHWs in the community. And so promise wrapping up here, some of the lessons learned with community engaged strategic health communication. I actually took all of that I know as a health communication scholar and as a former journalist and as a former public relations person, and took all of that and wove it into a class. And so I was so fortunate to be able to teach a class that was health communication and community engagement, theories, methods, and practice. And so um, here for my students, it was an opportunity for us to learn from each other. And what one of the assignments was to, okay, when we're thinking about the intersection between health communication, community engagement, at the end, what is it, a communication product? What could that look like? And so I'm really proud to say they had some very um, uh, just very creative products that they had. This is not one of them. This is something, this Divine Nine is something I pulled that is as an example. That was actually engagement with the African American community, which ended up being a town hall. So it wasn't something that was the science, but it was something that, you know, through a process, a series of engagement with African American pastors, different lay leaders, that they said, hey, you know what? We need a COVID-19 town hall to address some of the myths. And what better way to do it through trusted BGLOs or Black Greek letter organizations to talk about this, because you all are seen as the leaders in different spaces and addressing these things. So we need to have this this town hall, and this was just an example communication piece for that event. And my students were able to come up with some very creative pieces as well for the community engaged projects that they were in. So just quickly, future directions, just this community engaged health communication is something that is important, especially when advancing health equity among Black and other underrepresented communities, has implications for health and science communication. And also, I didn't even get to this, dissemination and implementation science, which going back to the example as the communication asset mapping strategy is something that can be very influential or important in disseminating information and also implementing evidence-based practice, such as genetic susceptibility testing in these communities. So thank you so much for your time and your patience. I appreciate and thank these entities because without these entities, I would not have been able to do this research. Hoping I did not leave anyone out. Thank you also for being here, listening to me. And that is it. So thank you so much.
Thank you so much. We have our first question, Clement Wilcox. Clement, are you able to ask your question?
I think so. Can you hear
There you
me?
go. Thank you.
Yes. Hi, thank you.
Thank you. Thank you for your presentation. It was really interesting. And I had a question. I am the engagement director for the 10,000 Families Study of the University of Minnesota. And so this is super interesting to me, how to reach out these populations, underrepresented populations. And so I wanted to know if you can speak a little bit about the impact of the changes in those communications, like if you initially had a baseline and then you can compare your results now, or a little bit. I know that there is a big research, but if you could speak a little bit on that, that would be great.
Oh, yes, absolutely. And thank you so much for your question. So in the context of genetic counseling and testing, so I'll speak to that first. both in Kansas and here, there was very little knowledge, awareness about that. So that was the baseline, where not only did we conduct focus groups, but then also we had pre-focus group surveys. And we wanted to see, one, if they had ever, if the doctor had brought this up, if they heard about it. And by and large, now this is not generalizable data, but among, that sample, very little awareness. And so then after that point, in Kansas in particular, we did a follow-up survey to see, one, if they actually went back to their doctor to get, to talk about genetic testing, counseling and testing. And there was a modest increase. And then also keep in mind, that was a time when we were doing this COVID-19 hit. And so we had, that factor. So here, it seems like there's similar as far as baseline, not a lot of knowledge about it. So I'm still in the process of gathering data here in the Salt Lake City area. And so that's in the context of genetic counseling and testing communication. So as far as other types of things and, my engagement, and I hope I'm answering your question as far as, has there been any improvement? I would say just now, I'm drawing from recent contextually and preliminary data, is that it has, just by holding these focus groups, going into the churches and talking to leaders, they're really excited about this and they want to know more. And so that's something that, it would, our research team, we're wanting to, for instance, after doing the focus groups, we're really wanting to go back into these churches and be a resource, first of all, for not just cancer-related genetic counseling and testing, but cancer screening, just broadly. So I hope I'm answering your question.
Yes, you are. Yes, you are. Thank you.
Okay, it looks like we have another question. Edie Kramer Kosteka, would you like to ask your question live? Let me let you talk. If I can find you on my list of attendees. Well, I can't find you on my list to unmute, so I'll ask. Thank you so much for this fantastic presentation, Dr. Lumpkins. Could you share insights about partnering with culturally representative community liaisons to recruit for and implement community-based research studies? How can we as university partners best support these culturally representative champions in study efforts?
Thank you. Such a great question. So I appreciate that. I would say, just in my experiences about partnering with these community liaisons, it is critical first to build that relationship. As I mentioned toward the end of the presentation, where working with Best of Africa, for instance. And, I'm new here. I also, in full transparency, I am a member of Delta Sigma Theta. And so being a partner, with that organization, still, it was important for me to, meet with these individuals, whether it's in person or via Zoom, what's comfortable for, these representatives, and being very clear. That goes back to some of the communication pieces that my students actually produced. It was, okay, well, we understand, research occurs at the university, but what's in it for us? As I talked about to my students, WIFM, what's in it for me? And they wanting to know, okay, what is the goal of this? And does it go beyond research? What is in it for them beyond just the research? And so being very clear, going back to those 9 principles of community engagement, and then also being very clear about intentions. And so transparency, just so important, being willing to, have several conversations, just not one. And one of the things I know that the co-members that are on this call know that's very important is that not only being very clear at the onset of your, your conversation with them, but what is the sustainability piece there too? And so that's something that, I have learned to have just this clear understanding as I go into a partnership. Is there a start? Is there an end? And then writing those individuals into your grant, being considerate of the time and the resources. And so one of the things I really appreciate about the Huntsman Cancer Institute, and I'm sure that there's mechanisms there with the Masonic Cancer Center, is that there's the money that is built in. I know it's not always about the money, but it's showing reciprocity and also going back to equity and value. And so that's something that's, has been really important for my process, is making sure they know, hey, we want to help in the way, in the capacity that we can help you to do what you do, and you're helping us to do what we do. So thank you so much for your question.
All right, thank you. It's 10 o'clock. We'd like to say thank you one more time for your presentation.
Oh, you're welcome. Thank you. It was so great to be here. Thank you.
Thanks so much.